Hello, good morning.
Good morning.
Uh-oh, let me turn up the volume here. Can you hear us okay?
Yeah.
Or-
Yes.
We're just waiting on one of our committee meeting members for a quorum who should be here momentarily. Sometimes, rain, right? We don't get that very often, so.
Yeah, it's headed my way, I think, tomorrow.
Are you up north, Tish, in Sacramento?
Yeah, I'm in Sacramento. So I guess I'll see if the roof repair job that we had earlier will hold up. It's a good way to test it.
Mm. It's a pleasure to meet you, Dr. Kumar. I'm Andrea. Nice to meet you.
Nice to meet you. Thanks for
Well,
inviting me.
absolutely. While we're waiting on Carol to get here, did you want to introduce yourself?
I'm sorry, say that again.
I said, while we're waiting on Carol Rogers to get here, who's one of our committee members, did you want to introduce yourself?
Yeah. So I'm Dr. Kumar. I'm one of I'm the medical director of OBGYN at Desert Regional, which is one of our level 3 NICUs and level 1 trauma centers for Tish. You guys know what that is. And so I do. I also consult for Redlands Community Hospital. um, you know, just for business development. And yeah, that's pretty much what we do. We have kind of stabilized the service here, and we're looking at some ideas on how we can improve care. I think that's one of our meeting agendas. So we've been having some discussions on freestanding emergency departments versus like any alternatives, anything that we can do to like um, help out, like have more outreach out in the community. I help with the recruitment, I think, of physicians, which is sometimes we can build facilities, but until you actually have doctors that can work there. So, and I work with the different universities. We had a couple of universities that were sending medical students. I think rural tracks are really important. And I think because that keeps the doctors in the community instead of moving out. And so kind of like I'm program director for transitional year residency and core faculty for that program as well. So anyways, that's kind of like in a short things that I do.
Nice
Awesome.
to meet you.
Nice to meet you too.
And then Tish, did you want to introduce yourself? We do have a couple guests with us, also members of the public. I think both of them are with Desert Care Network.
Yeah, of course. Thank you. My name is Tish Rylander. I'm one of the partners over at DeVoe Burr Group. I have my partners, Andrea DeVoe and Tim Burr. I am a contracted consultant and advocate, and I've had the pleasure of representing Desert now for maybe over 2 years. And we've done some great work together. Excited to continue doing that. Just quickly about me, I've been what they call the third house over as a lobbyist now for about 3.5 years. But before that, I spent 23 years working for the legislature, most recently as a chief of staff to former Assemblywoman Autumn Burke, who represented the Los Angeles area. And then I worked as a capital director. I worked for committees and worked in various roles throughout the legislature. And I know I age myself, but really, it's my entire career I've spent working in the legislature, and so kind of a big deal to leave. I never thought I would do it, but circumstances presented an opportunity, and I decided to go with it. So I really enjoy working on this side of things and putting that 23 plus years of experience navigating the legislature and agencies and departments to good use on this side of things. So it's great to meet all of you. And Chris, thanks for tapping me in here. And I think this is such a great idea to get together and meet to discuss what's going on in Sacramento and throughout the state.
Thank you.
So we'll just mute you for a moment. Like I said, Carol's on her way, and we don't have a quorum to start. Our other committee members a little under the weather, so we can't start until she arrives.
Okay,
We could maybe do a
Great.
quick round of introductions here.
that would
for-
be great.
Oh,
While we're
I didn't
waiting
think about
as well. Wanna go ahead, Andrea, and we'll.
So I think you guys know who I am, or maybe not. Dr. Kumar may. So I'm Andrea Hales. I'm the Special Assistant to the CEO. I'm the Board Relations Officer here at the Desert Healthcare District and Foundation. I've been here 8 years now, and I do a little bit of everything. So with the committee meetings, you'll see me at each and every committee. I don't think I've ever missed one or a board meeting. So here I am. Pleasure to meet you guys.
Nice to meet you.
I'm Eric Taylor. I'm the Chief Administration Officer for the District and Foundation.
And I'm Chris Christensen, the CEO here at the Healthcare District and Foundation. Been with the organization about 10 years, but full-time in the CEO role for about a year now.
I'm Alejandro Espinosa, and I'm the Chief of Community Engagement. Very nice to meet you both.
Nice to meet you.
Hi, everyone. My name is Kimberly Barraza. I'm a director with the Desert Healthcare District. It's been a little bit over 2 years. And for work, I worked with Assembly Member Eduardo Garcia on his tenure there in the Assembly. So that was good 10 years.
Yeah.
Thank you. Thank you for
Kimberly is also the chair of our committee.
Oh, yeah. I'm the chair of the committee. Welcome.
Nice to meet you.
Hi, and I'm Donna Craig. I'm the Chief Program Officer with the Desert Healthcare District. I've been here going on 21 years in June.
Oh,
Great.
Yeah, I know. With the stock market going, I don't think I'll be retiring anytime soon.
Linda, do you want to introduce yourself? Although I'm sure Dr. Kumar is familiar with you, but.
Sure, Dr. Kumar and Tish and everybody else. Linda Evans, Chief Strategy Officer for Desert Care Network, also Mayor for City of La Quinta, and happy that we've got a legislative committee engaged with the district, given the multiple things going on right now. Sam Roth, who is our government relations, was not able to attend, but I know these will be recorded and posted like the rest of the meetings. Is that correct? So if he needs to follow up, I told him that I'll send him the link for that, but happy to be here. Thank you.
Karen Follis is with us. Did you want to introduce yourself, Karen?
Hi, yes, I'm Karen Follis. I'm the CEO at JFK Memorial Hospital. My first time joining this meeting, so it's good to see everyone and looking forward to hearing what's going on.
We have a quorum.
And Mrs. Rogers has joined us. Thank you, Karen, for joining us.
My pleasure. Thank you.
We were just doing a round of introductions
Oh, good.
and that, so you came
Good.
in
And
perfect.
Dr. Kumar is here.
Yes.
Hi,
Did you want to introduce yourself?
I'm Carol Rogers. I'm the chief troublemaker. And I'm very interested in seeing where this is going with Miss Kimberly's help and her knowledge of the legislative process is invaluable.
Carol's our board president, by the way.
Nice to meet you, Carol.
And Maureen.
Yeah.
Yeah, until December.
And then no more.
What happens?
Oh, sorry. Were you doing yet? No. Oh, you mean? Or why is it someone? Oh, because the board's president is 1 year.
Oh,
board
I thought you meant
I
for.
thought you meant.
Yeah,
RN.
yeah.
No, I'll be renewing my license. I can,
Okay.
yeah.
Alrighty, so let's go ahead and get started.
And I've been a registered nurse for 52 years.
Oh, wow.
Ooh.
I will welcome everyone to our committee meeting. Can we go ahead and get the meeting started? It's 10:39. And probably meeting to order. Do we need a natural like roll call?
We don't, just notice that, Vice President Rodriguez is not with us.
Okay,
Yeah.
so item B, approval of the agenda.
I'll approve the agenda, motion.
Second,
All
all in favor?
Aye.
All right, public comments. At this time, comments from the audience may be made on items not listed in the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to no more than 3 minutes. The committee cannot take actions on items not listed in the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Do we have any public comments?
There are no public comments.
All right, perfect. So item D, new business. First item under this category, we have, SB 588, Health Facilities Freestanding Emergency Center Pilot Program. Will you speak?
Sure. Sure, I'll start it up a little bit here. So, also for purposes of how the agenda is laid out, items 1 and 2 are primarily part of what our lobbyists that Tish is here for. And so we set those at the beginning of the meeting. Tish, you're welcome to stay for the entire meeting if you would like, but due to being respectful of your time and energies spent with the legislature, you do not need to stay beyond those if you choose to. Anyway, so that first item, the CASB 588, is considered a spot bill, and I'm just doing general highlight with it, but we'll allow Tish to kind of go more in detail. So recently, President Rogers and others had spoken with Senator Ochoa Bogue's office about potentially doing something like this, developing maybe a pilot program even for a freestanding emergency department, particularly in the East Valley or underserved areas. So, but there's been some development that's been going on with that Tish and Sarah Bridge have been working on extensively with the senator's office, and they'll be working with some of the other legislators. So I'll let Tish, if you would like to give more information on that, please.
Yeah, thank you. So we were excited to hear that Senator Ochoa Bogue was willing to work with us in this space. We met with their chief of staff and legislative director. Originally, the idea had been to do a pilot program very specific to the district. And, they were originally, I think, receptive to that. I think once they started to look at the legislative history around freestanding emergency departments, they were more concerned that it was a larger lift that would bring in some opposition. And so they asked us to, consider other alternatives. One of the items that we really felt like was missing in this space, and that if we do want to pursue a pilot program or even a statewide program at some point, we felt it was necessary to really kind of pull back and do a study specifically around FEDs and whether or not they could provide timely emergency care, especially in rural, disadvantaged, and underserved areas. So we've spent some time building out, as you guys can see here, a framework for a study bill. And currently, and once we walked all the way through that with the senator's office, they were all on board. And especially given we think we could really work on creating a coalition of support around this, and help to overcome some of the challenges with even this is just going to be the cost around developing and implementing the study. And so we'll need to address that. So anyways, the senator's office really liked this idea. It builds a good base for potentially coming back and implementing some of the recommendations that would come out in the study. But so as of right now, this framework is with Legislative Council. It has been submitted by the senator's office. We cannot amend the spot bill. Well, actually, they went ahead and introduced the pilot program language. I think they would have preferred to have something less substantive, but so right now that bill can't be amended until March 20th. So Legislative Council is going to be drafting this, and then we will amend the bill March 20th. It will be referred to Health Committee, where we'll be working, Sarah and I, and then Charles Wright here at our firm, who also works for you guys, will work to generate support with the health committee chair, the health committee members, and the health committee consultants, and then the committee staff as well. So we'll be working that leading up through March 20th, using this framework until we get the language back from Legislative Council, using this framework to generate support, as well as additional co-authors. We think it would be important to have Senator Padilla as a co-author, not just supporting, but actually lend his name to the effort. I think we'll also be setting our sights on Senate Appropriations Committee to overcome any concerns they have about cost initially. So everything is still in the very beginning stages of the process. I'm sure Kimberly knows how lengthy and complicated the process can be, but so far everything is looking really positive. The senator's office appreciated this framework, and then we'll be also working to generate stakeholder support with other large groups, including, I think we'll be reaching out to the Hospital Association and ACHD and other folks as well to generate support.
Thank you for the update.
Yeah.
Any communication with Senator Padilla's office yet?
We've stopped by. They have been really focused on a few other things. So we've stopped by. We have a request into them. They have the framework, and so right now we're just waiting to set up a formal meeting and walk through all of this with them as well. So we'll do that. If they have, any concerns, or we think it would be helpful to set up a meeting with some of you that, Chris and maybe Kimberly, to just walk through it, that could be helpful too. So I'll keep you guys posted on that if we think it would be beneficial.
What we can do as well is to maybe the Senator's office will work on creating a fact sheet for it, and something that we'll be able to distribute as we go and try to get supported, and a sample that are supported as well. Does anybody have any questions?
I had a question. Do you think it's a possibility that Senator Padilla would sponsor a pilot project bill rather than a study bill?
Well, this year we've moved past the deadline for bill introductions. I think Padilla would have the same concerns about the opposition. I mean, there's that once they start looking at the past history around FEDs, it's been really contentious. And so our hope is that by doing this study, demonstrating that there's a need and a gap that they could fill in multiple areas throughout the state, we hope to build the case so that next year we're able to look at legislation, and rather than the folks that we would go to ask to author would have the findings of the study to point to as the rationale behind the bill, along with the experiences that you all have in practice. So to touch base too on what Kimberly said, the senator's office, Ochoa Bo's office, is going to lean on us to help draft their fact sheet, and then if we could put together a one-pager that would be a addition to their fact sheet, something a little bit more in depth. Usually the fact sheets provide a very basic outline of the problem, how this addresses the problem, and it just really summarizes things. But if we could go into a little bit more specifics, and particularly around Desert's numbers and our perspective, then we can use that too when we meet with other members to generate support.
So I had a question.
Oh, Dr. Kumar had a question.
Okay, so let's go ahead and go ahead, Dr. Kumar.
Okay, I was going to ask, is there, just because it sounds like reinventing the wheel, and I know that there are several other states where they have examples of successful freestanding emergency departments, but in health provider shortage areas and in rural areas definitions, So does inclusion and then, pre and post, like, okay, this is what the healthcare system was, this is how many uninsured patients were there, this was the wait times in the emergency department, you know, and then this was the amount of acute events, because that's what freestanding emergency department is targeting, so that people can get more timely care and more access, so that, you know, we have less acute events. Like mortality and morbidity are the basic numbers that we look at to see like how many people, what is the death rate in the community and what is the morbidity. Is that data something that we can present as an example? Because sometimes I think when we look at senator numbers and those levels, then specificity of the area is important. However, if we pointed out that, hey, there are other areas in the country that are doing better because of these type of circumstances, then there's a little bit more interest, just because the perspective is a little bit wider.
Yeah, absolutely. And I want to pull up, I think what we can do is perhaps add that in to the scope of the study to include a comparison of what other states are doing. Because right now, I think we've looked at, oh yeah. So under the scope of the study, we have operational models, review FED models from other states to determine best practices and regulatory frameworks. So that's very general. We didn't want to get overly prescriptive, but if there's ways to better state that. And once we get the language back from Legislative Council to see how they really craft this out, because this that we provided is a framework. I think if you guys have feedback on how we can strengthen that, or if there are specific data points that we'd want to make sure that HCI included in their study, then we can add that in too. So that's something that we can all definitely work on together. So once we get that back from Leg Council, then we can start working from that draft. But yeah, I think that's a great idea.
Yeah, my question was, in the past, how many bills for FEDs were introduced and what was the major opposition?
I think on the initial, I don't have a total history here, but I have in the last like 10 to 15 years. And I believe there were, I can actually send this to you guys, but there were a handful, maybe 3 to 4. And it seemed that the primary opposition has been from labor, and perhaps the hospital association. So I think that those two entities caused some concern. And so these bills historically have never even gotten out of policy committee. So they either fail in policy committee, that first stop, or they're not set at all. So I think the opposition is just so great that it's been hard to overcome historically.
Do you know the basis of the opposition?
I can send that all to you guys. Yeah, I mean, I think there's some analysis that have been available. But I think that there's just been some skepticism around whether or not FEDs can fill the gap. And so that's why I think the study is so important, is to address some of the issues, and it'll look at the concerns raised by opposition and take that into consideration as well. And so hopefully we're able to, with this study, demonstrate, the need.
So what I would recommend and see, right, of course, with your direction, Tish, and see if we can bring them onto, the working table ahead of time and not wait until the very last minute, and we can maybe start engaging some of those labor and maybe the
Yeah.
hospital association, and just try to let them know this is what we have in mind, and see if maybe we can get their support ahead of time or have their input and see what it is that they've proposed in the past that we can actually work into and see. Because I mean, there would be no point of us having this study done or conducted, and then at the end, we're gonna have very strong opposition, where it's just not gonna go anywhere. But I think we're in a very good, good direction, so. But, and then, do we know when we'll be getting the language back from Leg Council?
Right now, the date, I think the date to amend is, to get the amendments to Rules Committee is the 17th. So we should be getting it back within the next few days. And I agree with you, Kimberly. I think one of the benefits of doing the study is being able to bring folks like CHA in early, get their input and work with them through this process, and hopefully get to a place where they would be in support of whatever we would do next. And then be able to bring, and I have no doubt that labor will want to provide input on the study as well. So this is, the end product will be, I think, very valuable if we have broad stakeholder input and we start that collaborative, working relationship early.
Anybody have any questions? Comments?
Public comment.
Do you have any public comments on this item? Alrighty, then we are ready, I think, to move to the next item, AB 2019 Healthcare Districts. Chris or Tish?
Yeah, so the question had arisen in a board meeting in the last few months about if there's, number one, if there's more understanding to it, that we can broaden more of what we do as members of the board and staff. And then also if there's opportunity to be able to, speak with the author to see if there's more clarification, and then also if there's more opportunity to broaden or expand that language to allow more opportunity for especially our district to be able to engage more with the community in being able to get our grant funding out. We understand that there needs to be restrictions so that we're not going out and finding our favorite potential grantee to say, apply to the district because we've got resources, etc. But our hands are kind of tied right now with some of the ability to communicate with the public. So introduce that with Tish and Sarah. And so there you can let us know kind of where you're at working on that background history and what your thoughts are there, please.
Yeah, we're at the really early stages. I think this is going to be something that we're going to, work on throughout the year, especially if we're able to work with the author and get something prepared for introduction like January 1 of next year. But first, we want to build a coalition of folks that would be supportive of joining us and going to the original author and asking, just to start the conversation. And so we're reaching out to CPCA and the Nonprofits Association. We think that there's, this was originally passed in 2018 by Assemblywoman Cecilia Aguiar Curry. She's a very strong author. We have really good relationships with her. She is a member of leadership now. She's our majority leader. And so before we go to her directly, because we know she was very passionate about the issue when she introduced the bill, we want to build a small stakeholder group of folks who would be supportive of just opening up the conversation and going to Assemblymember Aguiar Curry to talk about the changes, what we've learned from the law since it went into implementation. Obviously, there have been a lot of changes, and now with the new administration, there may be opportunities to backfill, especially in looking at some of the impact that the administration and some of the decisions they're making are going to have on healthcare and healthcare districts throughout the state. And with all those changing dynamics, we would welcome the opportunity to revisit this and look for some more flexibility so that we can meet the needs of the community and ensure that, folks are getting the information that they need. And I think there, folks that need help sending out information and coming to the table. And so there's should be a way to find some middle ground at this point. So that is the next step, is to get together. Sarah and I and Charles will get together, meet with a few stakeholders, and then approach the Assemblywoman and just start there and find out what her stance is on reopening that conversation. If she's willing to. If not, then would she be okay with another legislator taking a look at that? And then from there, building out a broader strategy. But those are our first two stops.
My understanding is that this came about to be because within her district, there were a lot of nonprofits that were just granting out to like the same folks and the same friends. And it was one of those things where like, hey, you're the friend of the organization. We have some money coming up. Make sure that you apply. And so they wouldn't notify like the public in general or others. They were just reaching out to like their friends. And so that caused an issue. So that's why they were very strong and very strict within this piece of legislation. But I think it's important to understand, or to, like you mentioned, Tish, bringing people together and find out how it, like, what's been working and has not been working with a bill, because just trying to go back and try to strip a bill and say, especially when you're talking to the author, it's like, hey, like you messed up, now you have to correct it, right? And it is their responsibility to some extent, but in her opinion, she could say, you know what, it's been working perfectly within, my district or the folks that I know, or so it's very important that we do engage. Also understanding what the actual limitations are, because we might not be as limited as we think we are, and just understanding that. And it might be that we don't need like an overhaul of a bill or a piece of legislation, rather just a little section of it or an amendment. So
Yeah. And so those conversations, I think you're absolutely right, Kimberly. Those conversations will help us to figure out what our broader strategy will be, whether or not, like you said, legislation is necessary, usually to create uniformity and make sure that things are, we're not creating like one-offs depending on where you live, and that, you do want to create some sort of kind of level set adjustments. But it will all depend on where the Assemblywoman is and her willingness to revisit the issue. I know her to be a very rational, thoughtful representative, and I think she is certainly not one of those that would be above revisiting old legislation to see if there's opportunities to make it better, and whether or not it's serving its intended goal. And if not, then how do we still move to achieve what, she wanted to achieve when she brought the bill forward? So I think just being very thoughtful about how we approach her, and having information to share with her about the experiences that we've had, and then looking at other stakeholders that can share what their experiences are as well, not just from the healthcare district perspective.
thank you. Any public comments?
No public comments.
Yes, go ahead.
Well, I know that at ACHD meeting, when we were discussing one of the district's programs that they had as part of their foundation, the grants that they gave out, I asked if, what they did to notify the public because of the restrictions of AB 2019. And I just sort of got a blank stare from everyone saying, well, we haven't had a problem with that. And then on the other hand, I spoke with an attorney that was an advisor to this district. And I said, well, when I go out in the public, I just hand out my business card and say, go here to apply for a grant. And the attorney said, oh, I would never do that. They'll put you behind bars for that. So, we have this huge disparity in terms of what does the bill do and what does it mean. So
Yeah.
I think that's what we needed the clarification on.
Yeah. And it may be that, yeah, like Kimberly said, that there's a middle ground somewhere. There's maybe something we can do that, a meeting that we can set up or have a couple of conversations to figure out the actual, how does this work in practice? what does this actually look like? And how do we meet our needs and the needs of the community while not running afoul of the language? And maybe there's just some clarifications that need to be explored legislatively or just, within the oversight and departments that can actually weigh in there.
Well, and maybe a change in the policy so that the
Right.
policy language could be clarified, not necessarily the legislation.
Thank you. We're good. Are we good to go to the next item? Thank you, Tish. You don't have anything else to add? Yours good?
No, and some of the other agenda items, I mean, you're welcome to stay on, Tish. Maybe there is some input that you can provide. I
Yeah.
mean,
Yeah, I'll go on mute, and if happy to stay on. Thank you.
Great,
you.
thank you.
So our next item is Legislative Policy Committee Goals and Objectives. I think this is an opportunity for us to discuss what it is. We don't have to come up with a goal this morning, but I think it's important that we do start the conversation and start identifying some of the goals and objectives as a group. So go ahead and open the discussion.
Well, I think that knowing that we're having a consultant come on board to advise the district in terms of our future goals is to look at what some of the possibilities are in addition to FEDs, is that we've got, opportunities to expand the role of the district with some of the major funding that's coming our way in terms of FQHCs. I know Dr. Kumar had talked about a rural hospital in the past, and maybe he could give us an example or elaborate on it.
Yeah. So I was thinking that we should never put all our eggs in one basket. I think I know that we are waiting to see the FED project and see if we can actually launch like a pilot project. But again, at the same time, we don't want to spend all our time and energy doing that and then realize that, hey, it didn't, bear any fruits, and then we're back to square one. So I reached out to a couple of my friends in Missouri, and there is actually like the same hospital structure, like a smaller hospital structure / FED can be developed in a very innovative way so that it can be certified differently. So that's a parallel track that I think that we should pursue, because like the issue with FEDs and the reason we have like a lot of opposition is because it is an emergency department, but it's kind of like a quasi emergency department, like 911 has to like think about taking the patients there based on acuity. Then there's like EMTALA violations and physicians that can get mad because, there's a lot of transfer happening between the FEDs and the real EDs. And so sometimes that's a little bit frowned upon, and that's the resistance. However, in my opinion, it is better than nothing, because we can decongest the main ER from urgent and semi-urgent and routine cases, because that's 65% of the volume there. And so that can be, the problem is it's hard to, and the other thing is like, it can be a loss magnet too, like sometimes for companies. So they may get into the FED business and then realize that they're only taking care of like, it's not bringing in the correct amount of revenue for them to run that business. So sometimes a lot of FEDs close down because of that. So an alternative track that I was thinking that could be done is like we build a FED, but then attach 4 rooms, inpatient rooms, and kind of make it like a smaller hospital, a little surgical suite area. And we can bring a lot of innovation there, where instead of it being a full emergency department, it can be labeled as an attached surgical center / hospital. I don't know the legislation, but we have to figure something out, like how the OR should be there. And so basically take all the boxes for to be a hospital, and it's actually a freestanding emergency department. And in reality, it's actually a lot more safer, because if you need to admit a patient overnight, if you need to do a procedure which can be done there, then it can be, then it avoids a transfer, it avoids deterioration of the person. Plus, public, in general, people have a better satisfaction score, and and so it actually like takes care of the things, and so people actually start going there. The issue with the rural emergency hospital, is what it is called, is it has to be set up in the correct health provider shortage area district and in a rural county, hopefully, so which is our goal. And so market research, maybe some sort of analytical research can be done, so that we can capture and reduce the load on the emergency department. The other thing is, so market research is important for that as well, but it could be done faster. There are some companies that can do it, that I was learning in my MBA classes, like Pivotal Analytics and some other companies, and that's what they do. Once we have, if we have a rural emergency hospital, then it's really just a hospital, and it can work under the umbrella, or it can have its own license. If it works under the umbrella of a hospital, staffing becomes, because the other issue is like staffing. And so we can help out with that, because I think a lot of residency programs, and we don't have it yet, but I've been working on like establishing a rural track with some of the universities. And so you can have people who are from rural communities, and if you have a rural track established, then those physicians that are training under the rural track can be retained directly and can work as per diem in the main hospital and as a full-time staff member in the rural emergency hospital. So staffing becomes a little bit easier. Plus, if it's under the umbrella, this can be exploited a little bit more and see what we can do to reduce costs. Sometimes, like if it's, we can have micromanagers that are working in the main hospital, where they can maybe be looking at like the level of patients that is going in this rural emergency hospital, and shuttle nurses instead of shuttling patients. We can say, okay, like evening shift, we have extra patients. We do this all the time in the hospital anyways, like because we can move nurses from the medical floor to the surgical floor to telemetry, and that, so there's a charge nurse that's doing that. So that reduces cost to the cost of running the rural emergency. And it's also providing every provider that's working is working at their capacity. They're like airplanes. You don't want them standing around. They need to be working, and so that can be done. It's just micromanaging some of that thing, and a small team can be created in the main hospital that's like looking at volume, census, and supplying the rural emergency department, rural emergency hospital with the correct amount of personnel, and trying to keep the cost low based on census. So it's a complicated structure, but if it's run with good leadership, it's run well. So that's an alternative, and hopefully it's not frowned upon, because it is actually a hospital, and 911 EMS Services Administration will have a better idea of what that hospital can do and cannot do. And so that was kind of like one of the things that I was thinking about with Ms. Rogers.
Yeah, no, this is great. And I think it all comes into like, it needs to be considered, especially like if the study is conducted. These are things that need to be brought forward and be either studied as well, like how is it going to be run? And it's great insight that, unless you're working on it or, have that knowledge. But I really do thank you for sharing it, and let's continue in communication so that you can continue giving us those inputs as we move along. Thank you.
And while we are doing that, I was thinking the other day after we met, that this should be parallel research, because we really should be looking at the feasibility of FEDs as well. And again, it's going to go through that process. We'll do our background work to maybe establish like a rural emergency hospital, so that if the first one doesn't work, then we push the second one. But if we are able to actually get an FED established, then, or figure out what we need to do, maybe it needs to be a shortage area, then we can push that a little bit, push the boundaries a little bit more to like the deeper pockets, a little bit further away from the hospital where there is no care, and show the difference there. So the market study should be tiered for the FED analysis. It should be first a primary analysis for the area that we're looking at currently, and then a secondary analysis a little bit deeper. And then if we have that, then, and we have plenty of time, we have, to figure that out. So we have this first tier for the main site, and then a second tier, if we push that like deeper and say, hey, why don't we open it in this place instead of this place where there is no care? And this is how it changes the morbidity and mortality of the community.
What we'll do is we'll go ahead and share the language. Once we receive it, we'll share with you as well and see, ask for your input on it. So, thank you.
I think too with, like you first started out with the strategic planner, that
Mhm.
we had asked them in the RFP to do literature reviews, and one of the literature reviews was the Huron report, which also acknowledged all the shortages, not only in urgent cares and buildings and physicians and nurses and other workforce, but I think, if you get a really strong strategic planner, they'd be able to really look at this literature review, as well as which will hopefully be presented at this board meeting, but Coachella Economic Partnership has also, we've commissioned them to do an economic
Mhm.
analysis, so.
Okay, that'd be
Yeah.
great. Yep. Okay. So I'm thinking some of the
Tie
goals.
into a goal like that.
Yes, no, absolutely. So one of the goals would be to track legislation. And like the literature review. As a committee, we want to go ahead and add there that we'll continue our communications with our consultant.
And fold in our long-range planning with our consultant in terms of legislation that may be needed.
It's like, can you elaborate a little bit more? Like,
Well, if we, if the district decides to establish a FQHC, do we need legislation for that, or more than one, in our medically underserved areas? I know that in Coachella Valley, in our district, we have 3 MUAs. One in Cathedral City, one in Desert Hot Springs, and one out in the Mecca area. So, our long-range planning consultant can look at all 3, and is there legislation needed to establish healthcare in those areas, and what kind of healthcare?
what could be other goals for the committee? We have track legislation, literature review, continued communication with our consultant, just the planning for the future opportunities for the district. I think also identifying funding as well.
And tracking current legislation in the state in terms of how it may affect our district.
Funding.
So when it comes to anything with legislation, are you still just looking at the state level, or what's happening in the county and with the cities?
No, I think it would be local, state, and federal. And so we'll be adding an item to the agenda, or it is on here right now for updates. And so if there are any updates. Okay.
And Kimberly, sorry, this is Tish. I just wanted to add in to also every Friday, our firm generates a report of all the bills that we have flagged that we think would be of interest to you guys. And so you'll get that update, and it'll have links to the legislation and its status and everything on there.
Perfect, thank you.
You're welcome.
Alrighty. Any public comments on this item, D3?
No.
No. And then we can develop these as we move along. But I think it was important for us to talk about it during this first meeting. Item D4, Desert Health for District's Legislative Priorities Platform. I think it's important to establish a framework for what our agenda is going to be. I think we do this I could see ourselves doing this like at the beginning of the year and then, as the year goes by, we could, track those or see where we're at. So I'll open it for discussion. Any questions? Comments?
Develop some language for the bylaws as well.
What was that?
You have to develop language for the bylaws. You have all the other committees listed in the
Right.
bylaws of what their purpose of
Mhm.
meeting is.
I think we've developed that
Right.
already, because we incorporated some language, not that it needs to be revised, that's a different thing, but it got approved with the last board meeting.
Oh, okay. So that goes to
We,
the bylaws. Yeah.
we added that committee.
Okay.
I mean, what would be some of our priorities at this moment? We have, SB 588. Not too familiarized with at the federal level, and I was, hoping to have Greg here that he would give us some more, because I know that he is a little bit bigger than that and not like county level. But I think it's important that we think about what it is that we want it to be our priority, so we're not just like scattered all over the place, but very focused on what it is. And so of course, we know it would be legislation that would affect special districts, healthcare districts, health in general, and, from mental health to many of the other services or the things that align with our goals as a district. So I don't know if you have any input.
Yeah, well, and even federal legislation that impacts our nonprofits that we
Mhm.
deal with.
I would say, I'm sorry, I would say cuts to like Medi-Cal, Medicare,
Exactly.
any changes to health and, human services, department. So I know there's gonna be some changes and, there's.
Right.
Because the CMS, which is the Center for Medicare, I mean, that's a funds residency program.
Yeah,
That's.
that's gonna have a big impact on us. And what's good is that the district can take a public position on it and influence our legislature, state and federal.
Are we just limited to physical health? 'Cause I know we were talking earlier about environmental health too, or so, how are some of those changes too? For any climate policies, climate change policies,
Absolutely.
lithium extraction, is that gonna be making any changes from the federal government, state government? Around the Salton Sea? I know, because there was a lot of money earmarked by the federal government for the Salton Sea projects. Are those gonna still be, awarded out to some of these organizations? So I think we should also track those.
In legislation that's already passed, like Proposition 1, like, the behavioral health collective that we have, that's one of the things we're reviewing to see what the impact is on behavioral health and mental health, where funding is being. Greg is probably really good on that, he's
Yeah, and adding it there, maybe we could even add a section for just, like potential funding or. But what I want us to do is make sure that this aligns to our strategic plan for the district so that we're working hand in hand. Okay. So any public comments on this item?
No.
Okay, so let's go ahead and move over to advocacy and engagement. This is where we would be identifying potential partners. Like often we'll be meeting the advocacy efforts that we be doing either, like within the state legislature or like our supervisor, local legislators, what it is that we want us to do or engage. I know that we do have like legislative days with the association of healthcare districts. So I think that we would put that information there and then any others that we would be doing. We can actually have this item as an update as well if any of the directors or staff attends or if they want to just give us an update on it. And then also determine like if we're going to be taking positions on bills or any policies that we would need to get in front of the legislators or their staff members and how it is that we want to go about this. I don't know if we want to, let's go ahead and have a discussion. I know that you're very familiar with all your advocacy that you've been doing. Sorry, that you have any input.
Definitely, and I think that it would be important maybe at the next meeting that we hear about the cuts in the programs of the nonprofits that we support, I mean, we know that St. John FQHC reported that they had $10 million, $18 million cut in funding from CMS. So, you know, it's just
like the transgender and stuff.
right, right. And, you know, we're hearing about things coming down every day, and I think it's good for us to be aware of what's happening in our community and how it's gonna affect them.
So maybe this is an internal thing, but what staff person would be responsible for this? If we still have the open position, Chris, that public policy analysis? that had been
Do we have
approved?
an open position, public policy?
Within our organization, which are,
Oh. Oh,
Yeah.
and is it
so
budgeted?
Yeah,
Wow.
so it might be that, you know, we've kind of held off until we get through like our strategic planning process, but that certainly can be something if it comes out of that process.
it might be a good thing to bring it up now, since one, we now have a committee.
Mhm.
And we'll be a little bit stronger within like legislation. I think this would be good as well, because it would help us create a bridge. I know that within the collaborative, I know Jana, right, Jana, she was the in like a policy committee, and so I remember that's where we're like vetting some of these bills. So she was kind of working that within that space. So yeah, I think that we do need someone, but
Yeah,
in the
Greg was the
meantime, yeah.
working chair on that committee, and then he decided because he's on the direct. And we're still keep the, Gracie's kind of like the, little contact point now,
Okay.
but we did invite, Supervisor Perez's. I can't remember her name, the last name,
Amy,
Amy.
yeah.
Amy Gwen?
yeah, she's
Uh-huh.
interested in, being part of that working chair. as a
Oh,
working chair,
okay.
like, that's
Mhm.
a committee, yeah.
I
But
remember
there's
her
collaboration there.
Behavioral health collaborative
Uh-huh.
that we have established, yeah.
Yeah. So I remember attending those.
Mhm.
So I mean, that's also a good space to be able to like identify some of the things that are going on within like our local.
Right.
Uh-huh. So-
We're having a meeting on the 31st, so we can, with the working chairs, and she's coming, so.
Oh, okay, yeah, if you can invite me.
Sure.
someone, yeah, that'd be perfect. All right, any public comment on this item?
No.
Alrighty, and then item D6, we had local, state, and federal legislative updates. I'm not sure if we do have any other updates at the moment, but this would be a space or the place to review bills, like budget allocations and other like policy changes. So some of these might seem a little redundant, and we'll work on the agenda and try to like make sure that it makes a little bit more sense for future meetings. But I think these were important topics for us to review within our first meeting. Any comments?
Well, I'd like to hear from Greg. Rodriguez.
Oh, yeah, he's
Yeah,
under
yeah,
the weather
sure, yeah.
today.
Well, no, he's in Austria.
Oh, I thought it was, okay. Saturday, I know he mentioned he wasn't feeling well, so I
Yeah,
thought
that
that might
was,
be he.
yeah, last week.
Maybe that's why he couldn't join.
Mm.
Yeah, you make sure he's on the agenda next week, and I'll pick him up at his office.
Okay, alrighty. Any comments, any public
Next
comments on
month.
this? Item?
No.
So item E, future topics. Is there anything that we're missing that you believe that we should be including within our agenda?
I think the items we've talked about are good to have on the ongoing agenda, and
And I think having the policy analyst, I think would be very, very advantageous. That was a good point. going into it. Yeah,
As a
who
background.
knows that, yeah.
Maybe we could recommend it to the board and see. I don't know if we do need like an actual recommendation for you to look for someone or.
yeah, I mean, we have anybody in mind, but obviously we gotta publish it, but we can, and we can certainly recommend that from the committee level too, just so that the board's aware of it, that we would do.
I thought that would be a great
That would
idea
be-
that we get a public policy analyst on board to staff this committee and carry out the work of this
Mhm.
committee.
Yes. We can make that a recommendation.
And when within the supervisor's office, who is the one who oversees like their health portfolio?
I want to say that it's Amy,
Amy?
but I know that they'll change, but I think that it's been Amy, the one that's been, helping.
So I think it might be wise to, get an update from the supervisor's office and maybe even from RUHS Public Health to see how they're dealing with some of these things.
Definitely.
So kind of get an update from, Kim to see what they're hearing from the state level to the federal level as well. Dr. Chang, yeah, for those updates. I think.
So I know that we are opening back our committees and inviting some of the committees, members of the public to join the committee.
Oh, right.
We're working on
The
a policy
volunteer,
for
Right,
potentially.
so it might not be a bad idea if we do invite maybe our local legislative offices. I'm thinking Assemblymember Jeff Gonzalez, Senator Chua, Senator Padilla, we have someone from both congressmen's office, and also an invitation to county leadership. And I mean, I would even, and that's something within the local, which I didn't mention. I think that also what's going on within our cities, leadership should be considered. Oftentimes they're not, and it's a lower form of government, but it's also very important because sometimes they will be supporting some initiatives or their partners, or like I'm thinking the city of Indy, what we did with fentanyl. Some of those partnerships that we can, or whatever is going on within their government, does impact our constituents. I think it's important that we bring them in as well. And I'm not sure if maybe if we want to invite them to like every meeting, or maybe we do have like a quarter, or like maybe twice a year, we have a legislative update community meeting that we lead, and just to hear from them and see what's going on. I'm thinking of the city of Coachella just implemented the blue zones that we're working on, and in Palm Springs as well, yes.
Would CVAC, be able to maybe have be able to provide the updates from all the member cities?
Yeah.
Instead of actually having a member, a representative from each city, maybe say, hey,
Since
since
they do have the different committees, do they have I know they have a homelessness one, the infrastructure, do they have a health related ones?
I don't think so. They've got public safety.
Public safety.
Yeah.
I don't think they have a.
But they're slowly kind of going that way because of the air quality. I think, some of those conversations kind of put them in that, mindset that they might, so I think it might be worthwhile to, reach out to them and say, hey, what are you doing in regards to health?
Yeah,
I think that would be a good, because, they,
and representing, yeah.
and the
cities.
tribes, because they also have the tribes in there as well. That's another big group that we should also include is the tribes, because, they're also doing great work, especially Torres Martinez with the whole Solemn Sea Management Plan.
Linda would know.
They're heavily
Yeah, Linda
involved.
would know.
Yeah. Yeah.
Isn't Linda on? CVAC?
I'm on. There isn't a health specific CVAG if that's what you're asking, but Alejandro's right in terms of the emphasis on air quality and environmental concerns.
Thank you, Linda. Do we have, I know that we have Tish and her team within like the state legislature. Do we have any representation at the federal level?
No, do you do any of that kind of work, Tish, or?
He just put in the chat that she had to leave.
Oh. We don't have any specific to federal.
I know Live to Rise has a consultant on the federal level that they report at their Live to Rise meeting.
And CVAG does too. We have both state and federal on CVAG, and we just added state to Conservation Commission.
So let's determine if we do need someone. So if we do,
To
right?
get, on Live to Rise, they have an agenda item report from the state legislature and
Okay.
report from federal on every agenda.
Right. So, I wouldn't want us to pay for something that we don't need, but, I think that it's value looking into it and then
The policy.
first, and then, yeah, that's what I'm thinking. It could be him or her, whoever person is, and then, yeah. Mark this one. All right. Alrighty. Any public comment, for future topics should be? Item F, committee member comments?
I think you've heard enough from me.
What a good meeting.
We're happy to be
Yeah.
here, yeah.
Happy to be here, yes, and happy to see you, Dr. Kamar. You can go deliver babies now.
Okay, thank you so much for having
Thank you
me.
for joining us.
Thank you, everyone.
Yes, sir.
And I adjourn the meeting. 11:30. Thank you.
Bye, Linda.
Bye.
Bye.
Bye, see you this afternoon.
Okay.